Welcome back. It's mid-morning on WKYT, and we're sure glad you're here. February is Heart Month, and a lot of people don't realize that your heart and your ears have a lot in common.
Audiologist Dr. Vanessa Ewert is here to tell us more about this. Thank you so much for joining us. What is this connection?
Interesting link.
So basically, your ears, the inner ear has a lot to do with your blood supply. So where your heart's pumping that blood to your ear, if you have any kind of restriction or anything like that, you might have a decrease in hearing that we can actually see on your hearing test.
Really?
So it's important to get that checked out.
I'd never heard that, but it makes sense.
That's very interesting. You're saying that as prevention, exercise might be one of the things that you can is helpful?
Yeah, so a lot of things that affect your heart also can affect your hearing, such as smoking, being overweight or obese. So exercise, healthy diet, eating lots of omega-3s have actually been seen to help with your hearing health as well as your heart.
You know, a lot of people think of, oh gosh, it's time for my annual eye exam and all that. How often should we be having our ears tested?
So we recommend, if you've never had your hearing tested, to find your audiologist, because we specialize in that diagnosis and treatment of hearing disorders. And we recommend it at least on an annual basis, maybe once every 1 to 2 years. But if you've never had it checked, it's great to have a baseline, because there are lots of things that show up on that hearing test, certain different types of hearing loss that can actually show that you're at a risk for some sort of cardiovascular event or even hypertension.
You know, that really is an intriguing link. What does a test entail?
So typically when people come in, we take a peek in your ears just to make sure that there's no kind of obstruction in that outer ear space. Then we let you listen to beeps, tones, and at different frequencies or pitch levels that allow us to determine, is your hearing within that normal range? Are we seeing something that maybe would require some sort of intervention to treat your hearing loss? Or do we need to kind of refer you out to your primary health care provider or someone else in the medical field?
And of course, you're at Bluegrass Hearing Clinic.
Yes.
Are people a lot of times surprised? Because I would think that the hearing changes could kind of gradually happen. Are they surprised sometimes when they come in and get the results?
Sometimes. I do think that we've kind of had this push or initiative to get people to get their hearing checked earlier. So we're having a lot more people kind of surprised. Historically, people have waited many years to come in and get their hearing checked, so it's not as much a surprise. But these days we're finding that people are coming in younger, which is just better overall health in general. So
and you get ahead of it. Yeah. Well, thanks for coming in. We have the information. Bluegrasshearing.com is your website and your number, and we appreciate you being here.
Thank you so much for having me.